Hello, my name is Nicholas Mahensky, and I'm presenting topics on medical imaging technology and robot assisted surgery. First thing I would like to talk about is the medical imaging technology. This kind of consists of the x ray scans, MRIs, or CT scans, any kind of like scanning technology found in the medical field, at least along those lines. Um, so as you may not know, or you may know, that the government does regulate healthcare, and within healthcare, they are trying to, or have been, taking away some of the technology. More specifically, the X-ray technology, have been adjusting it and or reducing some forms of this medical imaging technology. And in regards to even the Affordable Care Act (ACA), they are kind of trying to see where it's going to go or adjusting to where this technology is going to be. Um, Pretty much taking out the old, bringing in the new. Um, this kind of new technology is found in the MRIs, CT scans, or even dose management, and where they're trying to make this type of technology more proficient. Especially in the article I read, they were going more in details of the MRI scans, and detailing out the fact of that they're trying to make it so that it's easier for the customer, easier, or not the customer, but specifically the patient, person getting the medical stuff done to them. The imaging is all streamlined. So it's, you know, like I said, it's working towards this idea of speed and proficiency for the patient. And along the lines of technology, there's also robot assisted surgery, which is the second subject in which I'm trying to talk about. Robot assisted surgery, as shown in the picture, is kind of an operator with these medical robotic arms assisting along the lines of a surgery. But these robot assisted surgeries are not more towards any surgery, they tend to use them more towards complex surgeries. Further along those lines, um, this type of surgery can be helpful. These using these robotic arms or this robot assisted surgery has led to more success and create opportunity. From this article I read on the robotic assisted surgery toward pancreatic surgery, um, it has stated that in the past, when doing these kinds of complicated, complex surgeries, complex procedures towards this pancreatic surgery, the success was maybe there, but not as much. They wouldn't do as many of these surgeries, and there was a lot of negative outcomes coming just by the regular procedures that they used in the past, specifically 1990 to around 2003. By 2010 and on, they have had more of these robotic assisted surgeries, and it's became more recommended during these risky procedures, not even just the complex ones, but they mentioned the idea of these like cancer or anything along those lines, these really risky, really detailed procedures that not normally they would go about. Um, and so, even with these robotic assisted surgeries that have these great outcomes or help out in these complex surgeries, there's also problems that have occurred from it. And it relies on the idea that these arms are more focused on precision. And when you have precision, it is required for a patient, to be positioned in a certain way. Without this specific position, um, there has been issues, which I read in this article, that stated that positioning is very key in success to the surgery. Um, and the way some of these patients were positioned, there was issues with them slipping around, or even simply there was patients who may be a little bit overweight or obese. Body mass index came into play, and patients were getting injured. Um, But through this, they have found alternatives to combat the problems of slipping within this procedures using the robotic assisted surgery, considering the fact of position and precision. They have found ways to kind of work around this problem. One was through air inflated positioning device that helps kind of move the patient easily without any problems, or also foam padding. Both of these kind of with one another kind of helped out with any problems occurring within the procedure or these complex procedures using robot-assisted surgery. In conclusion, medical imaging is changing. We are seeing newer technology come about. They are taking or changing old technology like the X-ray scans, usually is the physical copies or the printed ones. They are now changing those out, and then on top of that, just the new other types of imaging found in the MRIs, CTs, or even the technology for dose management. Um, Also, the robot assisted surgery being how effective it is, how precise it is, and its usefulness when it comes to complex surgeries. There are some problems with patients slipping around, which caused any a little damage to them, which is not good. But they have improved it with the padding and the inflation of the beds that help, or not even beds, but the devices that help with this device. Okay, thank you, and that is my presentation, and thanks for listening.